Welcome back to a new video on preclinical pharmacology. So today, in this specific video, we will gonna discuss about atrial septal defect and ventricular septal defect. So these are the contents which we have to cover in this video. Firstly, introduction, CHD and its types, what is ASD, its types, life expectancy in ASD, its pathophysiology, statistical data, what is VSD, its pathophysiology, statistical data, and treatment part. So, firstly, introduction. So, it is the basic introduction of heart, which we all know that heart, it helps in pumping of blood. It mainly contains four chambers, namely two atriums and two ventricles, involved in controlling the rhythm of heart rate along with the maintenance of blood pressure. Also, it provides essential elements such as oxygen to the body and removes harmful wastes such as carbon dioxide through the lungs. It is the basic structure of heart. We can see that superior vena cava and inferior vena cava, which collects all the deoxygenated blood from the body. Namely, superior vena cava collects all the deoxygenated part of blood from upper part of the body, and inferior vena cava collects it from the lower portion of the body. Firstly, what is CHD? So it is nothing but the congenital heart disease, also called as coronary heart disease or coronary artery disease, CAD. It is defined as the condition in which there is damage in the heart's major blood vessels, which is mainly caused due to accumulation of various substances such as fat, cholesterol, and other substances which are found in blood. There are mainly two types of CHD, namely acyanotic and cyanotic. Acyanotic. What is acyanosis? So it is the condition in which the supply of oxygen is maintained in a normal way, but the disease is associated with the heart. That is, it may be rather due to the atrium, due to the in the ventricular portion, or it may be present in the canal portion between both the atrium or ventricle. In this case, the pulmonary blood flow is high due to left to right shunt. Mainly what happens in this case, the pulmonary blood flow increases because the blood transfer directly from left atrium or ventricle to the right side. So various examples of acyanotic conditions are atrial septal defect, ventricular septal defect, and atrioventricular canal defect. Then cyanotic. So cyanosis is nothing but the condition in which the amount of oxygen supply is decreased, which reaches to the blood. Means the amount which reaches to the blood is decreased directly. Various examples of cyanotic diseases are hypoplastic left heart syndrome, pulmonary venous return, and truncus arteriosus. Now, what is ASD? So, ASD is nothing but the atrial septal defect, which is generally called as hole in the heart in general terms. It is the condition of heart in which an abnormal opening between the dividing walls, which are also called as septum or septa, between upper chambers of the heart, that is the right and the left atrium respectively. An atrial septal defect leads to the mixing of oxygen-rich blood, which is oxygenated blood from the left atrium, directly with the oxygen deficit blood, that is deoxygenated blood, to the right atrium respectively. It can also lead to enlargement of heart, abnormal heart rhythm, and damaged blood vessel due to accumulation of more blood than the capacity of the atrium. So it is the real image in which indicates the hole in the heart. So we can see that due to the presence of the hole, the oxygenated blood from the left atrium directly comes into the right atrium and increases the shunt, which is called as hole in the heart condition or atrio septal defect. Now, what are the types of ASD? So mainly ASD or atrio septal defect is divided into four types. That is secundum, primum, sinus venosus, and coronary sinus. So what happens here is secundum involves the hole present between middle of the wall between both the atriums. Primum involves the presence of hole at the lower portion of the septum between both the atriums or both the upper heart chambers. Sinus venosus, it involves the upper part of the wall near superior vena cava. The hole is present and which leads to the change in the structure of the heart. And fourth one is the coronary sinus, which in which the whole septum is absent, it is the most dangerous condition. Now, what is the pathophysiology of atrio septal defect? So atrio septal defect, basically it leads to increase in the left to right shunt, which basically indicates that blood flows from the left to right atrium directly, which increases the pressure in the right atrium, followed by right ventricular hypertrophy, ultimately which leads to enlargement of both atrium and ventricle of right side, which is also called as Eisenmenger syndrome. And finally, it leads to cyanosis, which is a deficit oxygen supply. Then life expectancy in ASD. So mainly the atrial septal defects are associated with increased morbidity and mortality ratio. According to Campbell report, annual mortality rate in ASD is 0.6 to 0.7% per year in the first 2 decades of life, that is up to 20s, which is increased up to 4.5% per year up to 40s, that is the fourth decade of life, and further it increases to 7.5% per year in sixth decade, that is up to your 60s. According to a study which is conducted by Murphy, the population who have operated the ASD at early adulthood, that is on or before the age of 25, having high chances of survival than those who operated later in life, having high mortality and morbidity ratio. Also, according to a report which is given by Doughty, about 27 late deaths were reported, which includes 18 due to cardiovascular causes every year. Now, what the stats suggest? So, atrioseptal defect are one of the common defects among congenital cardiac malformation. In India, around 2 of 1500 live births are of these cases. Worldwide, China is the top country in which around 15% of cases are reported annually, which is followed by India, roughly around 10%, followed by Russia, US, and Indonesia, and about 60% other countries belongs to other countries. Now, what is VSD? So VSD is nothing but the ventricular septal defect. Similar to atrio septal defect, ventricular septal defect also involves the mixing of oxygenated blood from left ventricle with the deoxygenated blood from the right ventricle. VSD is the common congenital heart defect. Up to 3 to 4 per thousand live births, VSD is present, 3 to 4 children. Mostly, cases for treatment of VSD is rarely seen, as in most cases of VSD, the septum auto heals itself by closing the septa. So what is the pathophysiology of VSD? So ventricular septal defect, which is similar to atrio septal defect, increases left to right shunt, that is the blood flows from the left to right ventricle directly, which increases further the pressure of right ventricle, which is followed by vascular resistance due to increase in the pressure, leads to increased pressure over single ventricle beyond its capacity, leads to the dilation of the ventricle, which ultimately reduces the amount of blood which passes through the aorta, which is the oxygenated blood. The amount of oxygenated blood passing through the aorta is decreased. Now, the treatment portion of both ASD and VSD. In many cases, ASD might not need any treatment if very small ASD is present, that is less than 4 mm in size. Then the cardiologist suggests them for a continuous follow-up despite of being operating the heart. Usually, if ASD or VSD hasn't closed until the age of 6 to 7 years, it is recommended by cardiologists to fix the hole, which is called as heart catheterization or surgery. Mainly, two types of first-line treatments are done to fix ASD. Mainly, firstly, catheter-based repair, and secondly, open heart surgery. So, first, catheter-based repair. Here we can see that a catheter tube, which is uh, placed inside the hole from which the mesh-like structure is being pulled out, which grabs the hole and remains over there, and the catheter tube is removed. With time, the heart tissues are getting developed on the mesh-like structure, which on later stages of life completely heals the hole. So it is the basic mechanism for treating the hole in the heart. Secondly, open heart surgery. So during open heart surgery, cardiologists mainly perform the sternotomy, that is They cut the breastbone, which leads to spreading the ribs. Once the heart is opened enough, a small cut is made to properly open the chambers of the heart. After that, a Gore-Tex patch is fixed at the site of ASD and the defect is cured for lifetime. Then, statistical data related to VSD. Then, isolated causes of VSD are about 2 to 6 in every 1,000 live births, which accounts for about 20% of all CHDs. In US, about 16,800 babies born every year with a VSD, that is 1 in every 240 babies born in US. About 85% of them are survived after their early diagnosis of VSD. So, thank you for watching the video. If you get anything from it beneficial, then hit the like button, share the video and subscribe to the channel for more such educational videos. Thank you.